Alright, so hoping you can still see the screen. So Alright, so this section addresses important implications of pathological changes in the body, protecting the client from harm, knowing how and when not to treat are essential for safe practice. Understanding the ways in which pathological changes affect the body's ability to accept massage and body work treatments and recognize the signs and symptoms of common pathologies will help the practitioners identify contraindications and understand the best way to proceed when presented with pathological changes in the body. So overview of pathologies, as I zoom in, study points, recognize signs of contagious conditions of the skin, understand the ways to adjust treatment based on the skin's pathologies, understand common musculoskeletal conditions and disorders, strains, sprains, trigger points, understanding various types of pain, acute, chronic, visceral, and somatic, understanding common conditions and disorders of the nervous system, example being MS, Parkinson's disease, and migraines, understanding common conditions of the circulatory, lymphatic, and immune systems, examples being hypertension, atherosclerosis, lupus, inflammation, and varicose veins, understanding the effects of common conditions of the internal organs, hepatitis, examples being hepatitis, emphysema, and diabetes. So signs of contagious skin conditions. So be very cautious about this. This is very important since we are directly working on people's skin. Alright, contagious skin diseases present with a wide range of symptoms. Some have similarities such as rashes, but most are very differentiated. So going to impetigo, red soreness around the nose, mouth, hands, feet, honey-colored crust developed after the sore ruptures, impetigo may cause mild itching and soreness. Alright, so work with me. I'm going to butcher some of these words horribly. Molluscum, contagiosum. This sounds like a Harry Potter spells. Molluscum contagiosum. Small firm bumps that are pink or skin colored with a dimple center. They turn red as the immune system fights the infection. Some bumps may itch but are otherwise painless. Molluscum contagiosum often appears on the face, neck, hands, arms, and armpits. Fungal infection, rash in moist areas of the body where the skin rubs against skin, such as in between the toes, under the breast, in the genital area. Athlete's foot, a cracked or blistered rash that causes stinging, itching, or burning, possibly an unpleasant odor, usually starts between the toes and can also appear on the soles and sides of the feet, and can spread to the toenails, groin, and armpit. Scabies itching that keeps you up at night, rash with small bumps that look like hives, sores from scratching that become infected and crusty areas. In severe cases, mites can burrow anywhere on the body but prefer between the wrist, elbows, fingers, and around the fingernails, the buttocks, belt line, penis, and around the nipples. Ringworm, a fungal infection that starts as a red scaly area. The area spreads outward and forms circular ring with slightly wavy borders. Inside of this circular ring may look clear, scaly, or bumpy and red. Sometimes several rings appear and overlap. And the last one, shingles. Pain, burning, numbness, or tingling red rash blisters that rupture and crust and itching most often appear as single strips of blisters that wrap around your torso, but can also develop around the eye, neck, or face. Shingles may also cause fever, headaches, fatigue, and light sensitivity. So, one more time, signs of contagious conditions of the skin. And these are a few different contagious skin conditions. So if you see any of these, you should not work on the client, or you should ask if they have had certain medical releases for them to be worked on. But in most cases, you should not work on these clients because these are contagious conditions of the skin. So by you working on that client, you're making yourself susceptible to catching this form of pathology. Common skin conditions that are generally okay for massages: psoriasis, eczema, vitiligo, rosacea, mild sunburn, and dry skin. The conditions that call for avoiding specific areas of the condition, skin conditions that call for avoiding specific areas of the condition but are okay to massage unaffected areas: folliculitis, boils or furuncles and carbuncles, acne, tinning, pedis, athlete's foot, unexplained lumps, lesions or rashes, varicose veins, bruises, sunburns, moderate to severe, inflammation, including arthritis, cancer, needs approval from physician. Always get your approval for working on a cancer patient, please. Radiation sites, approval from physician required. Please get your approval for working on cancer radiation sites, please, as a massage therapist. And also cuts. Most of the time when it comes to cuts, you really just want to avoid them, or if they're not bandaged, or if not, get a bandage for the client. So whenever you are working, you are not exposing yourself to any of the body fluids that they may still be dripping or leaking. Here's a list of skin conditions where massage is specifically not recommended, contraindicated, not recommended for any parts of the body because of risk of infection. Your therapist and or risk of infection of your therapist and or risk of infection or risk of spreading disease on the client. So again, here's a list of conditions where massage is specifically not recommended, contraindicated for any part of the body because of the risk of infection, your therapist and or risk of infection of your therapist and or the risk of spreading disease on the client. So impetigocellulitis, erysipelas, herpes 1 and 2, chickenpox, shingles, herpes zoster, tinea corpus, and other forms like ringworms, open cuts, So again, please do not work on them with open cuts. If someone has an open cut on your table, just kindly ask them to come back another day when the cut is closed or when they have bandage. Dermatitis, lice or mites, scabies, pitted edema, and frostbite. All right, so we've gotten through some of the contagious skin pathologies. Now we're going to understanding musculoskeletal conditions and disorders. Muscular disorders, MSDS, are conditions that affect muscles, bones, and joints. They are common and your risk of developing them increase with age. MSDS or musculoskeletal disorders include tendinitis, carpal tunnel syndrome, osteoarthritis, rheumatoid arthritis, fibromyalgia, and bone fractures. All right, so let's get a little bit more specific on what is a strain. A strain is a tear or rip in the muscle's belly or tendon. A muscle strain tends to occur at the junction between the muscle's belly and its tendon. Muscle is soft tissue composed of contractile cells that affect movement. These injuries are usually caused by excessive force or tension within the muscle fibers. Tensile forces are produced when the muscle is stretched beyond normal range of motion, causing the fibers to tear. Examples include Alright. Examples include quadricep strains, hamstring strains, and bicep strains. 3 degrees of strains are first, second, and third. So looking at the diagram right here, we have 3 examples of strains. And then let's go over what is sprains. Let's see if we have time to get inside trigger points real quick before we end for today. So, what is a sprain? A sprain is a stretch, tear, or rip in a ligament or joint capsule. The ligaments are sheets or bundles of collagen fibers that form to connect between two bones. These injuries usually occur when a joint is forced beyond its normal anatomical limits, resulting in the stretching or tearing of the ligament, joint, capsule, or both. Injuries to the ligament directly affect the joint stability during movement. Examples include ACL, MCL, LCL sprains, ankle sprains, and shoulder sprains. 3 degrees of sprains, first, second, and third. Examples are right here as seen. And this showing for an example of the knee. Alright, and then we're about to finish up right now, getting on to trigger points. So we're going to end here for today. Trigger points. We have 15 major trigger point places, so let's just look at them real quick. Pain, pleasure, pain, pressure. Oh, planger. Sorry. It's pleasure, pain, pressure. It's felt during trigger point manipulation. So we see the jaw, clenching, TMJ syndrome, neck pains, pectoralis, tennis elbow, wrist pains, mouse muscles from computer use, IT bands, side of the thighs, quads, shin splints, tired feet, and arc muscles on the front. Suboccipital muscles of the neck. And then we have upper back between the shoulder blades, lower back pain, glute maximus pain, hip sciatic, and then calf pain. That's for the posterior part of the body. So getting through this real quick, trigger points are discrete focal hyperirritable spots located in taut bands of skeletal muscle that reduce pain locally and in a referred pattern, often accompanying chronic musculoskeletal disorders. Acute trauma or repetitive microtrauma may lead to development of stress on muscle fibers and formation of trigger points. So if you already have a trigger point, it can develop into more trigger points, which we generally call those satellites. Trigger points may also manifest as tension headaches, tinnitus, temporomandibular joint pain, TMJ syndrome or TMJ pain, decreased range of motion in the legs and lower back, palpation of hypersensitive bundles or nodules of the muscle fiber of harder than normal consistency, is physical findings typically associated with trigger point. Palpation of the trigger point will elicit pain directly over the affected area and or cause radiation of pain towards the zone reference and local twitch responses. So again, we're ending right here on trigger points. This is slide 52. Today we went through from slides 34, endocrine system, going down to slide 52. So we went over the endocrine system, a few of the glands, hypothalamus, pituitary, pineal, thyroid, thymus, adrenal, pancreatic islets, ovaries, testes, the integumentary system, which is the skin, how it's affected, the three layers of the skin, which are the epidermis, dermis, hypodermis, what can be found in there, the sebaceous glands, fatty tissue, blood vessels, and it all gets deeper below the epidermis glands. The epidermis tissue. We talked about the dermatomes, which you have 7 dermatomes in the first part of your spine, the cervical spine, because your C1 does not have one. You have 12 following your thoracic spine, which you have 12 joints for there. In your lumbar spine, you have 5 dermatomes. In the cervical spine, sacral nerves, so it's the sacral part of your spine, which is near the tailbone, you have 5. And then the coccygeal, which is the tip, the end of the spine, you have 1. We talked about the glands, the pseudoferous glands, which emerge deep to the skin, the surface, and they help secrete sweat for the body. The sebaceous glands that connect the hair, they also release the oil that's produced called sebum. Our sensory receptors, nociceptors, our sensory receptors in regards to how we feel pain. If you do skeletal system, they only had an example of the humerus bone, so it can only show you what we have there. Digestive system, which included the mouth, pharynx, esophagus, stomach, liver, gallbladder, pancreas, small intestine, large intestine. More into the digestive system. Just making sure. And then from there, we talked about a few of the pathologies. Remember that this section makes up 14% of the questions on the MBlex. So we went through some warnings about pathologies real quick, and then some of the skin conditions that we should not work on, as well as examples of common skin conditions that are common to work on, some that are able to be worked on but not in that affected area, and then other conditions that you just want to avoid altogether. From there, we went down to understanding musculoskeletal conditions, ending with the trigger point. So thank y'all very much for those who attended, and I hope you have a great day.